For the next lesson, we're going to focus on patient encounter procedures and specifically how we go about protecting our patients. And so when you combine both this lesson, the next lesson on more patient encounter procedures, as well as what we're working on in lab, we get an idea of how we should be interacting with our patients on a regular basis to provide a safe environment for their care. So the first thing to understand when we talk about patient encounter procedures and maintaining a safe environment is the ideas of medical asepsis and the OSHA standard. So medical asepsis is part of infection control. And what this is the prevention of the spread of disease. And so obviously, when we talk about patient encounter procedures, one of our big things we need to focus on is the fact that we should not be spreading disease from patient to patient. And so we'll talk about hand hygiene, different cleaning and disinfection procedures as well. But not only is that good practice, but it is also required by law. And OSHA is the organization that focuses on that. OSHA stands for the Occupational Safety and Health Administration, and it focuses on workplaces ensuring the safety of the employees. And so when you combine medical asepsis and infection control with OSHA standards, we begin to create the systems that are necessary to keep our patients and ourselves safe. And so what we're keeping ourselves safe from is microorganisms, right? And these are tiny living plant or animal cells that can or cannot cause disease. Disease-causing microorganisms are called pathogens, but there are also non-pathogen microorganisms that are benign and do not normally cause disease. Medical asepsis, then, is the practices that are employed to reduce the number and hinder the transmission of pathogens. And so there are going to be a bunch of different levels of quote-unquote disinfectant or cleaning. And so it's important to keep all of these in mind. When we talk about medical asepsis, we're talking about the elimination of all pathogens. Non-pathogens still may be present, but since they do not normally cause disease, that's not typically that important. So if the idea here is to prevent the spread of microorganisms, it's important for us to understand what are required for microorganisms to grow, multiply, and stay alive. And there are 6 requirements that must be ideal for the microorganism to continue to grow and multiply. The first 2 listed here are proper nutrition and oxygen. And when we look at nutrition, you have 2 different types of microorganisms, autotrophs and heterotrophs. An autotroph obviously uses inorganic or non-living substances for food, whereas a heterotroph now uses organic substances for food. And so obviously that's going to change the requirements there. Most of the time we are not going to be manipulating the nutrition levels associated with microorganisms, but this also has to do with the ability of them to live on different surfaces. Obviously, autotrophs are much more resilient to living on different surfaces than heterotrophs are. Second is oxygen, and similar to nutrition, there are 2 different types that go there. Either ones that grow best with the presence of oxygen or those that grow best in the absence of oxygen. Temperature also affects the growth and multiplication of microorganisms. Usually right around body temperature is when microorganisms grow best, and that's why a mild fever has the ability to reduce the multiplication and growth of microorganisms. And that's the purpose of the fever, is to increase the temperature within the body and thereby decrease the optimal temperature conditions for those microorganisms. Microorganisms also grow best in dark places, and they tend to need moisture for cell metabolism and to carry away waste. So a moderate amount of moisture is important as well. And then lastly of the 6 is pH. Microorganisms prefer a neutral pH. And so when we talk about trying to provide medical asepsis techniques, we're looking at eliminating or taking away one or more of these requirements for the microorganisms to survive. And so obviously some of these are easier than others to do on a routine basis, but all medical asepsis techniques are going to come down to removing one of these 6 characteristics. So now that we have an understanding of what microorganisms are and what they need to grow, we now need to see how they are transmitted. And that focuses on what is termed the infection process cycle. With this, microorganisms, specifically within this cycle, are required to have this entire cycle intact in order for the pathogen to remain alive. And so when we get into the disease prevention and infection prevention, not only are we looking to decrease the ability of the microorganisms to survive outside the body, but also inability for them to transmit from one to another. And so let's take a look then at this infection process cycle. The first area here is there has to be a reservoir host. Somebody has to be infected by the pathogen and serves as the source of transition. The host is going to provide the nourishment for the microorganism to grow and survive, and these can be animals or humans. From there, the pathogen has to have a way to exit the reservoir host. Most commonly, that's the nose, mouth, but also throat, ears, eyes. Different bodily fluids can transmit different pathogens, and that makes sense, right? The way that pathogens exit the body is going to be from anything from respiratory droplets to any other bodily fluids. After that, they have to be transmitted and have to have a means of transmission. Basically, what that means is they have to have a process by which they can go from one individual to the next. That could be through what we talk about with upper respiratory tract infections and droplet infections, where they're transmitted through the air in these respiratory droplets, but they can also be transmitted through contamination of food, indirect transfer where the pathogen goes onto a third space, right, like a treatment table or something like that, and then transmits to the next individual. But there has to be some mean of transmission. After that, there has to be a means of entry. In order for the pathogen to continue to grow, it only has the ability to live outside of the human body or outside of the host for a certain period of time before those different characteristics that are required for growth are no longer possible. And so it needs to enter the susceptible host, which is 5 with that. So means of entry, it actually has to get into the human body. So things like mouth, nose, ears, eyes, intestinal tract, reproduction tract, open wounds, breaks in the skin, mucous membranes. These are all different areas where your body can get pathogens inside, and so it can start to affect the individual. And so obviously with that, the ability to protect and eliminate these means of entry are part of breaking this infection process cycle. And then lastly, there has to be a susceptible host who is capable of being infected by the pathogen. Your own body and immune system is going to also fight off these diseases. So for you to be infected, all 5 of these things have to occur. You have to be exposed to a reservoir host. The pathogen then has to exit that host. It has to have a way to be transmitted, then has to enter your body, and then your own immune system has to not fight off that infection. And so the infectious process and how infectious a disease is has to do with how able it is to complete this cycle. How easy does it leave the host? How easy does it transmit? How easy does it enter the next host? And how easy does it bypass that host's immune system? And so understanding the infectious process cycle helps us understand how we can go about eliminating these disease transmissions. And so the human body, as we see, has all sorts of different ways in order to protect itself from different pathogens. The most common and the biggest defense is the skin. Right? We have this large protective barrier against the entrance of microorganisms. There are only certain areas in the body that can allow penetration of these pathogens into areas where they can then get the necessary requirements for growth and multiplication. And within each of those areas, we have different components as well that focus on how to eliminate and remove and minimize those growth requirements. And so things like, stomach acid, for example, right, is used in digestion, but also discourages growth of pathogens that enter the stomach by being acidic and thereby affecting the pH of which the pathogen wishes to grow. So how do we go about doing medical asepsis in the medical office? Obviously, first and foremost, and the biggest one is hand hygiene. This is everything from hand washing with just normal soap and water to antimicrobial soap, and also alcohol-based hand rubs. And each of these have recommendations for appropriate hand hygiene, and we will go through each of them with that. But before we get specifically into hand washing, we have to understand the different types of flora or microorganisms within the human body. There's resident and transient flora. With resident flora, these are flora that normally reside within the dermis and epidermis. They're generally harmless, non-pathogenic with that. And so because they're on your skin all the time, they're very difficult to remove. And that's why they're considered resident flora. Think that they're constantly there, they live there. And this is normal. However, transient flora is picked up in our day-to-day activities. These will grow just on the epidermis or those most superficial layers of the skin. And these can often be pathogenic, and this is what we are focusing on. Right? They attach loosely to the skin, so it's important to think about this as similar to dirt, different aspects where the flora will actually attach to your skin, but these can be easily removed through hand washing or with an alcohol-based rub. So when we look at hand washing, you will go specifically through this in lab with that, but just normal hand washing with soap and water is usually good enough for most of this for removing that transient flora. The detergent really breaks down and then emulsifies that dirt and oil, which will allow you to wash that transient flora off of your hands. But the biggest thing with that, right, is the friction there to make sure that you are removing that mild attachment of the transient flora to your hands. And so that's where the necessary requirements come into play for how long you wash your hands. The CDC recommends hand washing be occurred anytime that the hands are visibly soiled before eating or after using the restroom. because the hand washing and excessive hand washing can actually dry out the skin with that, if they're not visibly soiled, a alcohol-based hand rub rather than hand washing can be used with that, and that will decrease the risk of dermatitis or irritation to the skin, which will create those micro cracks and will actually allow for more penetration of pathogens through the skin. Antiseptic hand washing then is the use of an antimicrobial soap and water. This has an extra element that not only emulsifies the dirt and oil and removes it and then basically washes away that transient flora, but has an antiseptic that is an agent that's going to kill or inhibit the growth of microorganisms. And so this is for when you are actually going to be doing minor surgeries, or you're going to be creating an environment, or you are with an environment where you have the increased possibility of that infection cycle occurring, either because of the break and the ease of transmission with like dealing with open wounds, different things like that after you take off your gloves, right, with that, or because you are now introducing an external wound, like if you were doing something like popping a blister, different aspects like that, which actually is considered minor office surgery. That's what that MOS stands for there, minor office surgeries. Most common then is the alcohol-based hand rubs. There are different types with that. It's more effective than regular soap and water for that removal of transient flora and reducing the bacterial count. Right. Also, it's much more accessible than sinks and water and is less damaging to the skin. The main disadvantage with that, right, is it's obviously more expensive, and that stinging sensation if there is broken skin with there. But you will look at the different hand hygiene techniques within lab. So next, let's move on and talk about infection control and good aseptic practices with that. Obviously, the bloodborne pathogen standards that we talk about with each year regarding how to handle different bloodborne pathogens and different bodily fluids, but just keeping things clean is helpful. Obviously, since light discourages the growth of microorganisms, as well as a more dry environment, well ventilated, light rooms will decrease the risk of microorganisms. That's why it's often very bright within those office spaces. And then obviously keeping things clean, avoiding coughs and sneezes of patients because of those droplets, wearing minimum jewelry or no jewelry at all, because those microorganisms can lodge in the grooves or crevices of those jewelry. One of the big components in the prevention of disease, specifically when coming in contact with any body substance, is the use of gloves. And so obviously the biggest advantage of gloves is it reduces hand contamination by 70 to 80%. And most importantly, when wearing gloves and wearing disposable gloves that are removed in between patients, you decrease cross-contamination because you're wearing a new set of gloves each time. If you're wearing the same glove throughout treating multiple patients, you still have the ability to decrease your own hand contamination as long as the gloves remain intact, which over time they do not, but that's another story. But you're still getting the patient-to-patient cross-contamination. So you should wear a new set of gloves for each patient that you come in contact with. And there are also then the ability for sterile gloves to do sterile procedures like those minor office surgeries that we talked about, or dressing changes, where you're going to come in contact with a potential entry point for a pathogen. And so sterile gloves have no pathogens on them. and that's what it means to be sterile. There are different types of gloves, latex and non-latex. It's more and more difficult to find latex gloves because of the high prevalence of latex allergies. But the reason that latex gloves were used and continue to be used is because they have a lot of advantages that nitrile or vinyl gloves, being the most common, do not have. And the barrier of these non-latex gloves effectiveness has not been shown as much as with latex gloves. But because of that allergic reaction that can be developed from latex, you see less and less latex gloves in there. So as I talked about, OSHA focuses on how some of these pathogens and medical wastes are regulated and how they are disposed of. And considering that medical waste and these different components serve as a major source of the potential of pathogens and the potential transmission of pathogens, how we handle regulated medical waste is just as much a patient encounter procedure as dealing with the patients themselves. So when we get into these standards there, the purpose of these is to assist employers in providing a safe and healthy working environment for their employees. So there's specific standards that are required within medicine and the use of medical devices that have to be followed by employees that have occupational exposures to pathogens. And so we'll look into some of these. The first one to look at is the Needle Stick Safety and Prevention Act that went into effect in 2001. Needles, because of their ability to pierce through protective environments and create their own entry points, are particularly problematic. And so in 2001, there was a act that was enacted to encourage measures to reduce needle stick and other sharps individuals. And so we'll look more at that later, but that's one of the first acts to keep in mind. Other terminology to focus on that is specific to OSHA is anything has to do with this occupational exposure. And this is considered if there's a reasonable anticipated skin, eye, mucous membrane, or other contact with blood or other potentially infectious materials with that. And so you have to think of this, that the OSHA guidelines come into play if there are any potential exposures, right, with that. And we call those occupational exposures. Bloodborne pathogens, right, are the pathogenic microorganisms that we see in human blood or other potentially infectious body materials that then can cause disease. And so you can see some of the most common ones there, and we'll go through those as well. As I somewhat described earlier with that, with the OPIMs, you can see a list of those listed there that are considered infectious bodily fluids according to the OSHA guidelines. Other terminology: contaminated, decontamination, non-intact skin, and exposure instance. You can read each one of those there, but obviously this incurs with regards to that infectious cycle. And each of these can be considered within that exposure instance. Anytime that there's the possibility of infection from a completion of that infection cycle, regardless of the possibility of pathogen or the actual presence, I should say, of a pathogen or not, that is considered an exposure instance, and things have to be done to mitigate those exposure instances. Also in there is the requirement for all medical offices to develop a written exposure control plan. How can we go about minimizing the potential exposures to our employees. And each of these plans have to include all of these different things listed here, including documentation and follow-up. It has to be available, obviously, with that, and it needs to be reviewed and updated annually. Also required under OSHA guidelines are requirements for labeling. And so the biohazard label that you see listed there is the most common warning label with regards to potentially infectious material. These labels have specific requirements within there as far as what they must look like. They have to be bright orange or orange red. They have to have that biohazard symbol as well as the word biohazard. And it needs to be attached to anything that has regulated medical waste in it. So regulated medical waste containers, refrigerators or freezers that are used to store this on the outside, and containers and bags used to store any of these sorts of things. And the purpose, obviously, is to alert employees to possible exposure with that on the outside before they get to the actual potentially infectious material. Within that exposure control plan, as we said, it must be communicated to the employees. With that, anybody that has the potential for occupational exposure must participate in a training program. That training has to be provided at the initial assignment to a task which might have occupational exposures as part of those duties, and then annually after that. And you must maintain records for at least 3 years of those trainings. In addition to other requirements within documentation, you must maintain that medical record for every individual with an occupational exposure. This is obviously confidential, but includes the exposures with that, as well as their vaccination status for things like hepatitis B. We'll see hepatitis B vaccination is required to be given as part of these exposure plans. Sharps injury log for anybody that has at least 10 employees has to maintain a log of all injuries from contaminated sharps. With that, you can see what's required to be in there, and the idea with that is to be in compliance with that Needle Stick Prevention Act. You have to identify where and when these potential injuries are occurring. At that same note, you have to identify any ineffective devices that are occurring as well. You have to include control measures within that, and we will look at some of these individually, but these are the different control measures. First is engineering controls. With that is engineering controls are anything that you're done to ensure that you can combine and produce a safe and effective environment. You can see some of the examples listed there and different components. You have to use safer medical devices whenever possible. These include needleless and safer sharps techniques, as well as documentation whenever a safer medical device is evaluated. You also have to include workplace practice controls, which reduce the likelihood of exposure with that. And so how can you go about doing these and providing different ways for your employees to decrease their risk of exposure? Also within there is all of these sorts of things and the controls and policies that you must do. So you can read through all of these different policies within those and what all of these are required. Moving on, we get to personal protective equipment that must be provided. Personal protective equipment needs to be worn when appropriate. You can see when each piece of personal protective equipment should be worn, with that gloves being most prominent and most important, but other types of protective equipment need to be worn, specifically chin laying face shields or masks anytime you see things potential of splashes or droplets, and other protective clothing when there's a possibility of gross contamination. So lastly, the guidelines associated with this all need to be completed within that. You read through this within your textbook as far as the personal protective equipment guidelines. The last thing to talk about, and we will introduce our housekeeping important things, and that will be the focus of part 2 of the patient encounter procedure. So I'm just going to introduce what housekeeping is. And this is basically the cleaning and decontamination of different areas and different procedures within that. And that's required within OSHA, that you have housekeeping guidelines. Right? Specific things include how each of these can be handled, handling contaminated laundry, anything that has to do with potential for biohazard conditions has to be included in your housekeeping policies and procedures. And these housekeeping policies and procedures include anything that are within medical waste. So regulated medical waste is any waste that poses a threat to health and safety. So you can see the things listed here that include any liquid or semi-liquid blood or other potential infectious materials, items contaminated with blood, items caked with dry blood, contaminated sharps, or pathogenic or microbiological wastes that contain other blood or OPIM, right, and need to be discarded with that. Some of those include anything with that for different dressings. And then lastly, with that, how to go about handling these are part of there. Obviously, you need to handle them carefully to prevent any exposures or any instances, and obviously wear gloves. So I rushed through kind of that last part towards the end just because that's an introduction, and I want you to focus on that on the second patient encounters procedures. We'll go in more depth with that. So as always, if you have any questions, let me know. Otherwise, have a great day.